Are you still with us, Dr. Muse?
Yes, I'm still here.
Okay.
Were you able to hear that?
Yes, we heard that. Um, so, could you tell us about the nature of your practice,
With the telehealth company or my practice?
your practice?
I'm a family medicine provider with obstetrics, women's health, and I practice full scope family medicine in Tennessee.
And where's your physical location?
6005 Park Avenue, Memphis, Tennessee, 38119.
So you practice family medicine and obstetrics,
Yes, sir.
and and so and you said that you're interested in a telehealth uh, practice with these nurse practitioners. Where are they located?
Tennessee, we have licensed nurse practitioners in Tennessee, Mississippi, and Arkansas.
Where in Mississippi are they located?
Exact city, Dr. Bachbrook can answer that.
And what is the nature of their practice?
Gastrology.
Gastrology.
Gastrology disorders.
Well, I guess I don't quite understand that you're in family medicine and obstetrics, and you're asking to collaborate with neurology nurse practitioners in Mississippi.
Sir, if I can chime in, I can share a little bit of additional context if that would be helpful to the board.
I'm sorry, who else do you have with you there, Dr. Muse?
Dr. Bachbrook.
Could you identify yourself, sir?
Yes, sir. My name is Dr. Vic Bakru. Last name, sir, is Bakhru.
So, what did you want to say, Dr. Baku?
Yes, sir. Thank you for the opportunity and the board's time today. Dr. Muse works with our company to be able to support the delivery of holistic health and nutrition through nurse practitioners. So, while the focus of Oshi Health, the telemedicine company that delivers gastroenterology services through gastroenterologists and their support staff, the nurse practitioners provide a range of general medical services under that practice. And it's one of those nurse practitioners that we are here today seeking support for remote supervision, sir, in honor of the 75-mile requirement. Happy to share additional details, but I'll keep my comments short in respect to the board's time.
Yeah, so where are the nurse practitioners located?
Yes, sir. They work predominantly from their homes. They're all licensed naturally in Mississippi, but require the supervision of a licensed physician in Mississippi and one who practices there at least 20 hours a week, and so on and so forth. And so we do their matching, but sometimes they're located in different locales. Our office for the practice is located in Madison, by the way, Mississippi, to your earlier question, sir.
And the nurse practitioners, they're doing mostly telehealth or exclusively telehealth.
Yes, they're exclusively telehealth. So they provide, for example, a patient that might be affected with a gastroenterology condition as diagnosed by a gastroenterologist and as under the care of a gastroenterologist or within the scope of their primary care physician. They often require, for example, after 18 colonoscopies, they require nutrition guidance. Maintaining a low FODMAP diet would be an example of the type of coaching and support that a nurse practitioner might step in and provide, along with a registered dietitian and other types of staff, sir, that provide these, call them, supplemental medical services or, accessory medical services that are all in the spirit of holistic health so that patients can find some relief from the symptoms that they're experiencing.
And um, so with would the practice include certifying patients for medical cannabis?
No, sir, this practice does not do any medical cannabis nor controlled substances. And happy to share much more, but again, I'll keep my comments short.
Okay. Dr. Gibbons, you have any
Yeah,
questions?
yeah. So, yeah, I'm Rod Gibbons, secretary. I'm trying to figure out logistically. We're kind of bouncing around as far as so. The nurse practitioners are located where? How many nurse practitioners are we talking about? Number one, and where are they physically located? Is the first question. And the second question is how is the patient interaction between the nurse practitioner designed based on your format?
Yes, sir. So there are 5 in total that Dr. Muse is seeking a waiver, and I'm here in support of Dr. Muse at her request, given my affiliation with the company that is employing the nurse practitioners and so forth. And then the second question, sir, you said 5, and then I forgot your second question. I'm so sorry.
So 5 nurse practitioners. Let's just pick just one. That one of those nurse practitioners is physically where?
Sure, sir. I can look that up. Give me just a moment. I do have it prepared for you, but I'll need just a moment to look up their home addresses. And
Or
there-
I mean, just I mean, a city. Just what city would they be in? And then
sure.
when they see the
The-
patient, where would they see that patient?
Yeah, so the patients all be located in Mississippi, of which there aren't very many today. And then the second part of the question is where's the nurse practitioner physically located? And they would, I believe, universally be outside of Mississippi. I do have a database here, and I'm clicking in to compare the names of the folks in our database. So, for example, nurse practitioner, one of them is named Ashley Anderson. And sir, if I go to the place where it tells me where Ashley lives in our database of providers, Ashley is based in Johnson City, Tennessee, sir.
Yeah, so she's in Tennessee.
Yes, sir.
She would be seeing patient via telemedicine.
Yes, sir. And she's licensed in Mississippi, of course. She has a Master's of Science in Nursing from East Tennessee State University and has a Family Nurse Practitioner Board certification from the ANCC. And she's been in practice for 17 years, sir. I'm happy to share any other info, just trying to give some context for who this person is.
Oh,
Well, ordinarily, you know, matters that we consider regarding any collaborative relationship include, you know, compatibility of practice, and it sounds like this uh, practice of holistic medicine, gastroenterology, it's not real closely compatible with Dr. Muse's practice. So um, that's something we'll have to take into consideration. You understand?
Yes, sir. And I would only offer that the services provided by the nurse practitioner are supported by 2 full-time medical directors who are both gastroenterologists. It's a multi-specialty practice, so there are general primary care services being offered by the nurse practitioners, and it is sort of those services that we are seeking Dr. Muse's support in supervising at this time.
So Dr. Muse would be the primary collaborating physician with these
She
NPs.
would be the primary supervising physician of record according to Mississippi state law, sir. And we do have 2 medical directors who support the practice, who are also gastroenterologists. So in that way, should we need to list multiple folks, if there were a pathway to do so, we'd be happy to. But most of the general primary care services, given again licensure requirements and in-state practice requirements and so forth, that asserts the need for Dr. Muse's support at this time.
Well, are you aware that there is a requirement for a backup collaborating physician to be identified on the protocol.
Yes, sir. And if, for example, if I go back to our database and I locate who we have listed, and I'm not finding it quick enough for the board's convenience, but sir, we'll make sure that those requirements are attended to and listed on the appropriate forms. I believe we filed the paperwork already, but happy to make sure we did it correctly.
Okay, thank you, Dr.
Thank you
Beckett.
for the guidance, sir.
You have any questions, Dr. Kennard?
I don't. Thank you.
Anything else, Dr. Gibbons?
No, I don't have any further questions.
Any, do y'all, is there anyone else on the Zoom with y'all? Is there anything else that you'd like to say?
Not for me, sir. I'll turn it over to Dr. Muse, and we are the only two representing this issue, sir.
Okay, thank you. So we have a request for an exception to the 75-mile rule, and it seems that you would also probably need a request for an exception to the 2080 rule. There's a requirement to practice. Sorry, Dr. Cleveland.
She has an office in Mississippi that she works at least 20 hours a week in.
Thank you. Okay, thank you.
Dr. Muse, is that correct?
That's correct.
All right, thank you.
Okay, thank you. Well, in that case, does anyone have a motion regarding this matter? Would entertain a motion to close the meeting, and
Yeah, I make a motion to close the meeting, considering where to go into executive session.
we have a motion. Okay, we have a motion and a second to close the meeting, move to executive session. All in favor?
Aye.
Any opposed? The ayes have it. The meeting is closed. And we will discuss whether executive session is needed. So we'll be right back.
Dr. Lippincott, would y'all be acceptable to inviting Dr. Latore for his education purposes?
Yeah, go back. The executive committee is now back in open session, and Dr. Kennard will,
Givens.
excuse me,
That's okay.
excuse me.
I-
Our secretary, Dr. Givens, will give our decision.
Okay, executive committees met and the request for the exception to the 75-mile rule has been denied. Any further discussion regarding that matter could be taken up with Dr. Cleveland on Monday.
Thank
Thank you
you.
for the time.
Thank you.
Okay, and the next item for the executive committee this morning is a Zoom appearance by Dr. Excuse my, please correct me if I need it. Dr. Rohith Jesudas, MD, requesting an exception to the 2080 rule. Good morning. Good morning. Could you tell me how to pronounce your name, please?
You got it right. So I have nothing more to say. It's Rohith Jesudas. Thank you.
Good
Thank
morning,
you.
Dr. Jesudas. Welcome to the executive committee. Could you tell us how you would hope that we might be able to help you this morning?
Thank you. I'm requesting an exception for the 80-20 rule. I'm a pediatric hematologist based in Memphis, Tennessee, and my employer is St. Jude Children's Research Hospital. The address is 262 Danny Thomas Place, Memphis 38105. We have a catchment area that extends into Mississippi and Arkansas. And one of the things, we have a large sickle cell population that we manage in Mississippi, including the area around Tupelo, which is about a 2-hour journey to and from Memphis. Most of our patients are on hydroxyurea, which is the only disease-modifying drug for sickle cell disease that needs frequent monitoring. And the goal of this telehealth program, we run a telehealth program. It is to help patients at least avoid some of the telehealth monitoring visits to travel to Memphis for that.
Okay. Thank you, Dr. Jehudas. Is this an existing practice? Are these nurse practitioners seeing patients now?
Yes. So the nurse practitioners, they also work at St. Jude. They are employed by St. Jude. They have the same office address as me. Invariably, I see them in clinic multiple times a week. We talk about these patients all the time, either in person or through our Epic chat or text. And yes, so they are also employed by me, by St. Jude, sorry, and they work with me in the same office.
And you all have Mississippi licenses?
Yes, sir, we do.
And do the nurse practitioners, do they come to Tupelo to see the patients now or what?
We have no, they are stationed in St. Jude as well, but we have a hub and spoke model where we have a clinic in Tupelo where the patients come to and do telemedicine from the clinic.
Okay. Okay.
And there are other patients as well where we do telemedicine from home. That is directly to the patient's home.
Okay. So, I guess I mean, if you're already doing that, why are you requesting the exception at this time?
It was flagged that I don't fulfill the 80-20 rule. So that was flagged and it was brought to my notice. So I am now requesting an exemption from that.
Okay, thank you, Dr. Jehudas. Mr. Barnes, do you have something?
I do. Thank you, Mr. President.
Mr. Barnes is our attorney.
Good morning, Doctor. with Dr. Jesudas today are two of his attorneys, Mark Garrica and Jonathan Warren,
Oh,
both
okay.
from Butler Snow. So I forgot to introduce them. Want to do that now in case they have something to add on behalf of the doctor.
Okay, is there anything, first, is there anything else that you would like to say, Dr. Jehudas?
Uh, I'm going to repeat myself. Basically, this clinic was set up with the purpose of helping our patients not miss school and the parents not miss work. And I think we've kept that and we've established that with multiple patient satisfaction surveys where parents and have told us repeatedly that that this telehealth clinic is serving the purpose.
Okay, thank you, thank you. Um, we can recognize, sir, please identify yourself.
Mr. Chairman, thank you. My name is Mark Garriga, along with Jonathan Warren. Appreciate the opportunity to be here on behalf of St. Jude Children's Research Medical Hospital. Dr. Jesudas has done such an excellent job of explaining what the situation is. He's made his lawyer practically unnecessary here. So I'll be happy to answer any questions, but just to clarify, both the nurse practitioners and Dr. Jesudas are located in Memphis. They're all licensed in Mississippi. The telehealth clinic is located in Tupelo, and it's placed there just for the convenience of the patients in North Mississippi. Many of them have to have follow-ups every 3 months to 6 months. And so instead of asking them to leave work, their parents to leave work or to leave school, they can go right to the telehealth clinic. They're very short check-ins. Dr. Jesus can tell you more about that. And so that way they don't lose an entire day. And they're, as you know, the board has the authority to waive the 80-20 rule. That's why we're here, for good cause. There are a number of reasons we believe that have been summed up by the doctor's testimony for good cause, including the fact that everybody's licensed in Mississippi. It's for the convenience of the patients. And it's very helpful to that population.
Okay, I'm just trying to understand the logistics. The patients go to the physical clinic in Tupelo,
That's right.
and they have to have blood work and medications or whatever there.
I'll let Dr. Jesus clarify that, but you're right, there is a telehealth clinic there. It's a shared facility. There are other Le Bonheur Hospital is also located in that building, and there's a coordinator there. But all of the actual blood work and things like that take place in Memphis. These are just for follow-up checkups. But Dr. Jesudas, did I get that right?
Yes, Mark. I would add, though, that when they come to the Tupelo telehealth, to the clinic there, that day's lab work gets done at the clinic.
Oh, okay.
But apart from that, yes, the nurses there take the vitals, take a short history, and then they connect, have the blood drawn, connect with us via the telehealth machine, and there's the physical examination to the extent possible via telehealth is conducted. We have a conversation, advice about the medication, and usually the labs come back in the next couple of days, and our team calls the family, updates them of the results, and if there's a change in the hydroxyurea dose or the medication, that is conveyed to the the family. Occasionally, we get results that most all of these patients we expect to be stable. They've been on hydroxyurea for a while and on a stable dose. Occasionally, it happens that we get a value that is a critical value that we need to address, and we have 24/7 coverage for these patients just by the nature of them being St. Jude patients. So whoever's on call informs the family about the next steps based on that.
Okay, thank you. And did you say that some of the patients are treated at home via telehealth?
So yes, there are some patients who are not from the Tupelo area, but from Mississippi as well, and if they take and if their travel is usually more than an hour, or if they have social circumstances that need them to be able to have their labs done locally, those are the patients we see directly at home. In sickle cell, if we are seeing our patients every 3 months, that means it's about 4 visits a year. 2 visits a year, they have to come to St. Jude. We just cannot, there are lab investigations, special investigations, radiology investigations, and a lot of them are on clinical trials as well, that we need to see them in St. Jude. So that is non-negotiable. It's the remaining 2 visits that before I got introduced to the program, I thought wouldn't make such a difference to them. But then after experiencing what the patients have told me, just even those 2 visits to be done at home or not having to come to Memphis makes a huge difference in their lives. We've also had a few patients who've started hydroxyurea who are not starting the medicine just because they didn't have the means to come to Memphis 4 times a year. And once we made that twice a year, they started the medication.
Okay, well, thank you. Thank you for explaining that. Do we have any other questions?
And Mr. Chairman, I also have a copy of Dr. Jesudas' CV, should anyone want to see it. Thank you.
Dr. Kennard, do you have a question?
I don't have any questions. I'm impressed by the optimization of exactly what the essence of telemedicine should be, in my opinion. Personally, I'm one board member, but I don't have any questions for them. They answered them. I think this is a model for how anyone should represent what they're trying to do and ask for exceptions to rules. So maybe we should post it on our website, but if you'll accept a motion, I'd like to make one to grant them, this doctor, the exception.
I'll second.
Okay, we have a motion and a second to grant the request for exception. All in favor, say aye.
Aye.
Aye. The ayes have it. And I'm just like to mention, I live in Tupelo. I'm a psychiatrist up there, but I appreciate your service. And I guess that's it regarding
Thank
this.
you. Thank you very much. I appreciate you taking the time to hear me out.
Thank you.
May we be excused, Mr. Chairman?
Yes,
Thank you.
thank you. Okay. The next item on our agenda is a Zoom appearance by Dr. Shamalon Johnson, requesting an exception to the 2080 and 75-mile rule. Is Dr. Johnson on the? Is this the? Good morning, Dr. Johnson.
Good morning.
Good morning. Could you tell us about your situation and how we might be able to help you?
Yes, good morning. I want to thank the board for their time. My name is Dr. Shamalon Johnson. I'm a board certified psychiatrist, and currently I'm asking for an exemption for the 2080 rule as well as 75-mile-hour rule. I am currently the medical director for inpatient geriatric psychiatry unit in Meridian, Mississippi at Anderson. And I was unfortunately unaware of these rules until I got an email from the board, and I immediately called the board to see what could I do to rectify this situation. This is work that is currently being done. We have 2 nurse practitioners that are also located in Mississippi. I am located in New Orleans and practice in New Orleans. We have a 14-bed unit. We admit individuals with serious mental illnesses, schizophrenia, bipolar, major depression, dementia with behavioral disturbances. We get patients from all over Mississippi. Some of them are involuntarily committed there, in a court commit. Others are voluntary. We also get patients from as far as Alabama. I am responsible for overseeing this unit. I review all notes, sign off. We use Epic, so I sign off on all notes. I sign off on all admissions, all discharge plans. I see every patient and formulate a treatment plan each week with those patients, along with social work, nursing, and pharmacy. We see the patients via Zoom. There are 2 nurse practitioners. Of course, I'm licensed in Mississippi that are licensed in Mississippi. This is our collaboration for inpatient work only, but they also have their own practices and they're domiciled and live in Mississippi. And we have been doing this work. I've been there for about 2 years. I think the company, the subcontract with ATC, which is Access Telehealth Care, which is the name of the company now, but they've had this contract, I believe, about 4 or 5 years. And so for us to continue, this is critical work with, you know, patients that have severe mental illness. And again, we get patients from all over the region. There is a shortage of mental health providers and certainly a shortage of inpatient mental health care, not only in Mississippi, but throughout the United States, as many of these big institutions and kind of safety net hospitals have closed. And I'm requesting both exemptions to continue the work that we've already done. I also have Miss Attorney John Wheeler with me, and I'll stop here for the sake of the board.
Thank you, Dr. Johnson. I just had a question or two. I was looking at your application here, and it looks like the 2 nurse practitioners, they're physically located in Meridian. Is that correct?
Yes, they are located there, and they have their own. Once they finish the hospital work, they also have their own private practices that they see patients in.
And they see the patients face to face in the hospital.
They normally do Zoom. I think they have the ability to go in, but this is through a telemedicine contract. So primarily they're seeing them through telemedicine. I think every now and then one of them, Stephanie, will go in on the weekends, but it's a telemedicine contract. But I think occasionally they do go in physically to see patients on the weekends.
Okay, yeah, I'm a psychiatrist up in Tupelo, and I work at a geriatric psych unit there too, and it's similar. We do most of it. We do some telehealth, some face to face. But anyway, y'all have any other questions for Dr. Johnson?
I don't have any questions, but Ken, do you personally find the telehealth services beneficial and effective?
Well, it's workable.
Yeah.
And
it's needed.
And it is needed. Yeah. Dr. Johnson, I'm just curious. What do y'all have an age range that y'all accept there on your geriatric?
Yeah, we are typically 55 and up. Of course, we have patients who've, if they're in long-term care facilities, sometimes we'll take people in their 40s if they, have been in long-term care facilities. We make an exception, but typically 55 and up.
Sure. If y'all don't have any further questions, does your attorney have anything he would like to tell us?
I don't, Mr. Chairman. I'm happy to entertain questions, but consistent with what you heard from Mr. Garriga a moment ago, I do think that Dr. Johnson's presentation to the board and the executive committee this morning certainly shows good cause as to why it is that the 75-mile and 20-80-hour rules should be exempted in this case for him. This is, as you know well, and as I think the committee knows well, an underserviced area. This is all inpatient care, and it does involve Dr. Johnson providing oversight to these nurse practitioners on 100% of their charts, well beyond the requirements that might apply to the nurse practitioners. So he is providing appropriate and consistent oversight for an underserviced area in an area of need. And so I do think he has presented that good cause for the executive committee to consider that exemption, and we respectfully request that the committee do that.
Thank you, Mr. Wheeler. Good to see you. So, Dr. Johnson, do you have internists or medical specialists that do medical clearance and treat the medical problems? Or are these nurse practitioners certified in psychiatry and family medicine, or what?
They are certified in both. However, we do have this hospital, again, this is Anderson Regional Medical. So we're technically like a freestanding, like a mile away. So we do have hospitals that they do the admission HMPs, and they administer the care for, chronic medical illnesses, hypertension, diabetes, And if things acutely come up, like many of these patients have UTIs, so they will start the antibiotics. They will order, the labs and appropriate, diagnostic testing as we follow along. So we have a hospitalist that's on call 24/7 for these patients.
Okay, so are you supervising any other nurse practitioners in Mississippi besides these there at the geriatric psych unit?
No, these are the only two, and this is the only work that I'm currently doing in Mississippi.
Okay, well, thank you. Y'all have any other questions?
No question.
If not, we can entertain a motion.
I'd like to entertain a motion to grant the request.
Okay, we have a motion. We have a second.
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Aye. The motion is approved, and your request is granted, Dr. Johnson. And thank you for your service.
Thank you. Thank the board, and thank you for your time. I appreciate it.
Thank you, Mr. Chairman. Thank you, members of the committee. We appreciate it. May we be excused?
Yes, thank you.
Thank you very much.
Okay, moving right along here. The next item on our agenda is a Zoom appearance by Dr. Daniel Smith. He's Dr. Smith, are you on the Zoom?
Yes, I am here. Thank you. Thank you for your time this morning.
Yeah,
I can briefly explain. I'm a psychiatrist by training. I primarily practiced in Tennessee for most of my practice, but moved back to Mississippi a couple years ago and have been practicing in a family health clinic in Laurel. But I'm also teaching at the MSU Meridian Physician Assistant Studies program. I'm getting ready to retire, to stop practicing, but I hope to continue to contribute by collaborating with nurse practitioners in Mississippi who are seeing outpatient psychiatric practice patients both in person and by Zoom. One of them is located in the Flowood area, and the other one is located in Hattiesburg area. And for those reasons, I'm requesting exception to both the 75-mile rule because I'm located just south of Meridian, and also the 20/80 rule since I won't be practicing anymore.
Yeah, just for clarification, for purposes of this regulation, mental health is classified as primary care. So I don't think we need an exception to the 75-mile rule, do we?
That would probably be correct.
Yeah.
Yes, sir. That would be correct.
Okay.
Okay, that's great.
So,
Mr. President,
yeah.
can I ask this question? Have we ever had this request of a retired physician to continue collaborating?
And
it's 7 years from me,
I
but
think
never heard.
a fully retired would be an unusual situation. I think we usually require them to maintain at least some type of active practice, whether it's just a few hours a week or something.
Yeah. We have the distinction of an ability to stay licensed, but retire. I don't know exactly the logistics of it. Is that what
Well, so
Dr. Smith would be?
To address I think the question that you're trying to ask is, as long as he renews every year, he has a fully unrestricted license. So, and in Mississippi, there is no license status of retired.
Oh, okay.
So I guess maybe clarification would be, so Dr. Smith, you're just basically trained, I'm sorry. Yeah, right. Yeah, Rod Gibbons. So basically your definition of retirement is basically you're not going to be office based. Is that sort of correct? You can kind of go home and then supervise the NPs. Is that?
Yeah, so yeah, that's a distinction. I'm not going to be seeing patients directly myself. I could perhaps see patients if asked by the nurse practitioner to do a second opinion or a consultation, but I won't be seeing patients primarily by myself. I would still be active in a sense in terms of collaborating and training and helping to support other mental health professionals in the state.
Okay. And so you'd be renewing your license and maintaining that.
Yes, and of course, maintaining continued medical education.
Okay. So basically just transitioning out of the office to, so technically you're not retired, Doc.
Yeah.
Sorry.
Well, yeah, I guess I'm not retiring from clinical practice. Yeah.
That actually helps me position my question better. Is collaborating with nurse practitioners considered practicing? I think in a way it is if you're actively doing it on a weekly basis, and therefore does he really need the exception?
We've always viewed it as kind of a gray area, right? Certainly, if somebody is practicing out of state, we do not allow them to count telemedicine towards the 2080 rule. And so if you take that and then apply it to somebody who's not seeing patients, but they are here in Mississippi, it creates kind of a gray area, I guess is the best way I can put it. But it would, if this question came to me as executive director and prior to it coming to the board, I would deny it because he's not in active practice.
Yeah.
I mean, so we just, we require active practice to count toward the 2080.
Thank you for putting me right back where I was at the beginning.
I mean, we're in a, you know, as with a lot of things, telemedicine in the year 2025, we're in uncharted territory. And so to some extent, if the executive committee and then the board were to approve this, it would be setting a new precedent that we haven't used before. So.
Thank you, Dr. Cleveland. So I had another couple of questions, Dr. Smith. How long have you been collaborating with these two nurse practitioners that you're requesting an exception for?
So I actually have not been collaborating with them because this is a new phase of my career. I have collaborated with many other nurse practitioners in the past throughout my work, but I essentially moved back to Mississippi 2 years ago because of a sick family member. So my practice completely changed. And I really moved into a teaching role primarily, but also just 1 day a week at the clinic I mentioned before in Laurel. So I haven't really been doing much clinical work in the past couple of years because of that. But I appreciate the conundrum you guys have in terms of the rules and setting a precedent. I'm just trying to, ask permission for this because there is such a need for collaborators for nurse practitioners in the state, particularly in mental health.
Yeah, and so the nurse practitioners that you've been collaborating with, so have you been, meeting with them quarterly and reviewing the charts and having the, quality assurance measures and all that?
Yeah, so previously the places I worked before, I was in the same, I worked at University of Tennessee, and then I worked at Kaiser Permanente in Colorado, and then also in Nashville. The nurse practitioners were part of our practice. And so that was just, we were always there on site together, collaborating together. And so this will be a new phase, and I definitely understand the requirements for the chart review and also the face-to-face meetings quarterly. And having documentation of the interactions, documentation of the collaboration discussions.
So have you had any collaboration with nurse practitioners in Mississippi?
No, I have not had since I moved here 2 years ago.
Okay. And what's your job at the clinic in Laurel?
So I was a consulting psychiatrist there 1 day per week. There were nurse practitioners there at the Family Health Center in Laurel, but I was not their collaborating physician.
Okay. Well, I'm a psychiatrist up in Tupelo and still practicing, but this is an interesting situation. What could you tell us a little bit about your training?
Yeah, I don't know how far back you want to go. I went to college at Ole Miss, med school at Vanderbilt. I trained in psychiatry at the University of Pittsburgh at the Western Psychiatric Institute. I'm board certified in adult psychiatry and also child and adolescent psychiatry. As I said earlier, worked at the University of Tennessee in the Student Health Center for 26 years, at Vanderbilt at the Counseling Center Health Center for a couple of years, and then I was at Kaiser Permanente in Denver. So I primarily worked with adults. At Kaiser, I also work with geriatric patients. These nurse practitioners would not be seeing children or geriatrics. It would be only outpatient adults, would not involve cannabis or ketamine, would involve controlled substances.
So how did these nurse practitioners and you get together?
Yeah, so there are agencies that they sign up with that recruit physicians and sort of middleman agencies to try to fill this gap to meet the need.
So they have a clinic in Meridian, is that correct?
They
Do the nurse practitioners have a clinic where?
No, so one of them is in Flowood, and so they're basically starting their own private practices. One has been a nurse practitioner for about 10 years. The other, as I mentioned before, is in the Hattiesburg area, has been a nurse practitioner for about 3 years. And so they've been working in clinics, and they're planning to start their own private practice sort of on the side. So they'd be relatively small practices.
Okay. Okay. Any other questions?
I have a question, just a comment. I think this is new ground, and I think it deserves a full presentation to the board, whether today or another day. And I would offer, being the chair of Rules and Regs, to take this conundrum through our committee first before we set some new precedent or expectation that the full board doesn't get a chance to have input on. So I don't think it's necessary to go into executive session to say that. I'd like to make a motion, if you'll ask for one, to deny this for now until we can take the position of the full board and possibly change our rules language to be more explanatory of what our expectations are for
Yeah, we'll
physicians that are not actively practicing and collaborating.
thank you, Dr. Kennard. Yeah, we'll accept a motion. Could you please restate the motion?
The motion is to deny Dr. Smith's request at this time.
Okay, we have a motion. Do we have a second?
A second.
We have a motion and a second. All in favor, say aye.
Aye.
Aye. So, Dr. Smith, probably gonna have to deny your motion for the time being, but there may be some hope for the future. So we wish you well and thank you for your service.
Yeah, I just want to say I appreciate your time, and I also appreciate Dr. Kinnear's thoughtfulness on this. I think, to try to thoughtfully look at possibly expanding the possibilities for people like myself who are retiring, who, obviously from one day to the next don't become incompetent to collaborate. But I think there's such a need. I appreciate the willingness to look into this area. So I appreciate that. Thank you.
Thank you.
Thank you, Dr. Smith.
Okay. Well, the next item on our agenda is a Zoom appearance by Dr. Vekash Raja, if I'm pronouncing that correctly, and good morning, Dr. Raja. Could you tell us how you hope we might be able to help you?
Yeah, good morning. Yeah, you pronounced my name correctly, Vekash Raja. So basically, I applied for the Tennessee and Mississippi license to start my job at the Memphis Neurology, but unfortunately, it was denied. So I just want to kindly request for the allowance of the Mississippi license. Basically, I am from Pakistan. I did my medical school from Pakistan and did my neurology residency of 3 years in Pakistan. Then I work as a neurologist over there for 2 years. and I have an experience of neurology in the Kuwait, and I came to the US in 2021 and started my movement disorder fellowship at the University of Nebraska Medical Center, which I completed for 3 years, and then I started my another fellowship in the neurocritical care. So I applied for the neurology position at the Memphis Neurology in Tennessee that also cover patient in the Mississippi. So they asked me to apply for the Mississippi and the Tennessee license. And I got an email. I fulfilled all the requirement which I was told regarding my verification of residency training from Pakistan and fellowship verification from the University of Nebraska Medical Center and from Buffalo, New York for my neurocritical care. Then in the September, I got an email that you are not eligible for the Mississippi license. So I'm here for this. And one thing is more, I have a active physician license in the state of Nebraska, Connecticut, Illinois, and New York. Full physician license.
Have you worked in those states?
Yeah, I did my fellowship in the Nebraska, so I have a physician license in Nebraska. I did my fellowship in the New York, so I have a full physician license in New York. Then I applied for the jobs in Connecticut and Illinois, but unfortunately I didn't get the job, and now I have applied for the job in the Mississippi and Tennessee. That's why I need a license.
Have you been in a residency in the United States?
No, I didn't did the residency in the United States, but in the Pakistan, I completed my neurology residency, and I also provide the verification of my training from Pakistan directly from my program director.
Are you board certified?
No, I'm not board eligible or board certified based on my fellowship overseas, but I have an experience of 2 fellowship in the United States for 4 years, 3 years in the movement disorder and 1 year in the neurocritical care.
Did you complete all of those fellowships?
I completed my 1 fellowship movement disorder that was for 2 years, but I extended my fellowship for 1 year more, so 3 years in the movement disorder. But my neurocritical fellowship was for 2 years, but I completed my only 1 year because I am on the visa and I need something to stay here. I am on the H-1B visa that can be extended for 5 or 6 years. So I didn't complete my 2nd fellowship in the neurocritical care, and right now I'm in the search of the neurology position here.
Mr. Kennard, you have a question?
Yes, thank you. Probably again, another question for our executive director, and that is, what makes this different? I'm reading Part 2605, Chapter 1, Rule 1.1D. So what in Dr. Raja's case was necessary to bring this before the executive committee? Just give me an idea of why this isn't kind of open and shut for him as it would be for any other applicant.
So the way we manage the application process is he was vetted through the licensing department, and then any application that is questionable is sent to me. I denied it. Everybody has the right to appeal, and this is his appeal to the executive committee to override my denial of his application.
Thank you. Are those 3 things that are highlighted before us under his Zoom appearance summary? None of those 3 have been met, and there's an expectation that they should have been. For any other applicant in his situation, they would be required to meet those.
Absolutely.
Okay.
Yes.
And Dr. Kennard, if I could, if you look at the certifications for his fellowships, they are not ACGME certified, and that is is that correct, Ms. Boone?
Yeah.
And that is you're right, that's an absolute requirement of the rules.
Okay.
Okay. Um, um, any further discussion, Dr. Raja?
But I was told about this. My fellowship is non-ACGME, and I don't have any proof of the ACGME here. So I was told in the July to provide the waiver request for this. If you have an offer from the Mississippi or Tennessee, so I provide the waiver letter in July of this year regarding that my fellowships are non-ACGME, but I have a 4-year experience in the neurology, and might be that was considered. Then I was told for the verification of my training from Pakistan, from fellowship verification from my 2 institute. So I was providing all the requirement, and that was the initial requirement in the July, that your training is non ACGME. So I already provided the waiver request. Then I fulfilled all the requirement. Then in the August I was told that you are not eligible for this state license. So I have spent thousands of dollars behind this. So if it was the decision, then why I was told for further requirement for the verification training, my background, fingerprinting card, and verification of my state license from US, and that I have already completed that one.
Okay, thank you, thank you, thank you, sir. Any further discussion for the committee? If not, we'll entertain a motion.
Make a motion to deny the request.
We have a motion. Do we have a second? Second. We have a motion and a second. Any further discussion or debate? Not, all in favor of the motion, please say aye.
Aye.
Aye. Any opposed? The ayes have it, and the motion passes, and the request is denied. Thank you, Dr. Raja. Anything else? Okay.
So
Y'all may remember several years ago when Dr. McClendon was the president, he asked that I start giving an update as to the duties of the executive director to the executive committee.
First, let me make sure that.
Oh, okay, I'm sorry.
Dr. Raja understands that that's all we have in your request, Dr. Raja. Thank you for appearing, and if you have any further questions, please contact Dr. Cleveland, our executive director, Monday of next week. Thank you. Okay, sorry, go ahead, Dr. Cleveland.
My apologies for stepping out of line there.
Well, I know you're so eager because that's the next item is your executive report.
I just want to congratulate the executive committee on being so efficient today. We budgeted much more time for y'all, and so, but thank you for that.
We remember when Dr. McClendon made that request.
Yeah.
And we thank you for your service.
Absolutely. So, as I always mention, I continue to meet monthly with the other health boards. The Board of Nursing is represented here today by Phyllis Johnson and Shan Montgomery. It's good to see y'all. Thank you for joining us today. As always, we continue to meet monthly with our Physicians Health Program. Met several licensees concerning potential violations of the Medical Practice Act. And I continue to participate in the Administrators in Medicine's roundtable discussions monthly. October was a busy month for me. I was in Washington, D.C. on 3 separate trips, all of them related to the Federation of State Medical Boards. One was Advisory Council, which is a group of executive directors that meets with executives involved in decision-making at the Federation, and we advise them on a state level what we're seeing and where they could better serve the state boards. I'm also on a work group for alternative practices medicine, and actually Phyllis is on that work group as well. And we believe we're representing the state of Mississippi very well, in our own opinion. And then the last one was the Federation of State Medical Boards board meeting. And just to not be deficient, in November, Sunday, I will fly out for Denver for the annual meeting of the Interstate Medical Licensure Compact. So everything else, I will address at the full board meeting during my executive director's report. But thank you.
Thank you, Dr.
Sorry to interrupt again. Can I speak more? I have one request.
Keep it brief.
Okay, so if it is not approved, I cannot get the license. So can my fees will be reimbursed or refund, because I am the sole earner here. I have my family and not doing anything now. I spent $560 for this license. Can I get a refund of this one?
No, I'm sorry, that's not possible, Dr. Raja.
Okay. Okay, thank you.
Okay. If there's no further business for the executive committee, this meeting is adjourned.
Hey.